Welcome to the Gynarchy Podcast. This is your host, Dr. Kirti Patel. Here we place women's health and feminism front and center where they belong, engaging in conversations that range from the fundamental to the fearless. With insights from expert guests, we aim to break through the barriers of the patriarchy and envision a new world led by the Gynarchy. So let's get started and dive right in. Welcome to the Gynarchy Podcast. This is your host, Dr. Kirti Patel. And today, in honor of MLK Jr. Day, I have a very special guest. Her name is Dr. Uché Blackstock. Dr. Blackstock is a graduate of Harvard University and Harvard Medical School, a former associate professor in the Department of Emergency Medicine, and former faculty director for recruitment, retention, and inclusion in the Office of Diversity Affairs at NYU School of Medicine, and is founder and CEO of Advancing Health Equity. She has received numerous awards, has been featured in Forbes, Fortune, and Time magazines, appears regularly on MSNBC and NBC News, and her writing has been featured in numerous publications. Her memoir, Legacy, A Black Physician Reckons with Racism in Medicine, was published this year by Viking Books and has become a New York Times instant bestseller. Welcome.
Thank you so much for having me. I'm excited to be here with you in conversation.
Thank you so much for taking time out of your busy schedule. Oh, I want to show your book. It's beautiful. I hope everyone reads. I thought we'd start, since it's MLK Jr. Day, with you reading. In the beginning of your book, you quoted him, and I thought it was a beautiful quote, and I would love for you to share that.
Sure. Of all forms of discrimination and inequalities, injustice in health is the most shocking and inhuman. Martin Luther King Jr.
Thank you so much. Yes, I hope that's something that will guide us going forward, all these years later. Uché, please tell my audience a little bit about yourself. Well, actually, first, yes, tell us a little bit about yourself, and then also what inspired you to write this book.
Okay, so I'll try not to include what you had in my bio, but I am an emergency medicine physician by training. And I also am the founder of a strategic health equity consulting firm called Advancing Health Equity, which I founded almost 6 years ago after I left my career in academic medicine. I've been associate professor of emergency medicine for 10 years, and I made this really hard decision to leave not just my institution, but academic medicine, because I really wanted to be able to do work around health equity in a very authentic way. And I felt like the only way I could do that was really to have my own company. And so it's almost 6 years in March, super excited about that. On my journey to sort of recognizing that, I had to do work the way that I wanted to, I had an increasing social media platform. And I was also able to, when COVID hit, I was one of the first voices in the pandemic to really raise the alarm about racial health inequities. And in doing so and being in alignment, so to speak, my literary agent, she heard me on a local NPR show and cold emailed me and said, you have a story to tell, especially as a second generation Black woman physician, which is something that's incredibly rare. You have something to share and you have a story to tell, and you're the only person to tell that story. And so the whole goal of Legacy is to use storytelling, personal storytelling, telling stories about my mom, and using those stories really to be able to discuss these sometimes can be lofty concepts around racial health inequities, systemic racism, but to do it in a way where it really connects with the reader so they feel engaged and feel like they can do something about it.
I really did love how you weaved your personal story from childhood all the way to now and pointed out the many barriers you faced, and I want to get into that. But actually, you mentioned your mother, and you did dedicate the book to her. And I was very moved at many different parts when you spoke about her, and I'd love for you to share with my audience a little bit about your mom, who you dedicated the book to, who inspires you clearly.
Yeah, she inspires me every day. And, I had the fortune and luck to be able to be raised by not just only a dynamic woman, but a woman who had really gone through so much in her own life. I live in Brooklyn, New York, about 15 minutes away from where I grew up. My mom grew up in the same neighborhood, but under very different circumstances. She was born to a single mom, raised on public assistance. They were always moving. There was a lot of food and housing insecurity. And she became the first person, despite all of that, in her family to go to college and finish college. And then, had a chemistry professor there who said, you should apply to medical school. And so she applied to medical school and got into all of her medical schools and ended up at Harvard Med School, where she felt like a fish out of water. But, she found her people there. And actually, of note, she went there in the early 1970s. And that was around the time that Harvard Medical School had started their diversity initiative. So in her class, there were about 10% of the students were Black, which was significant at that time. But after that, she could have gone anywhere. Like many Harvard medical students, they stay at the Harvard teaching hospitals, or they go to another Ivy League teaching hospital. But she came back to New York City, trained at Harlem Hospital, and then ended up working in the same neighborhood that she grew up in Brooklyn. And so that was the exposure that I had, like her as a role model. And then also she and other Black women physicians did a lot of community-based work in our neighborhood in the 80s and 90s, like when we weren't even talking about health equity or DEI. They were really doing such wonderful advocacy work on behalf of their communities. And so this is everything that I saw as a child growing up. And so I saw the representation. I knew that I could be a physician. That wasn't something that was impossible to attain. And then my mother, she passed away when we were 19 years old. My twin sister, Oni, and I, from acute myelogenous leukemia. And that obviously felt was like the rug was pulled from underneath our feet. And I'm still processing it all, but really wanted to use legacy as an opportunity to tell her story, for people to find out about this really amazing woman who died too early.
Yeah, she does sound really inspirational. And I think it's interesting that you mentioned, how there were, you said 10% of her class were Black. Okay. Yeah. And I think you mentioned in your book also how that in NYU, you had an experience with or you mentioned that there was a year when there was only one Black student. Yeah. So we've gone so backwards, and I know. We all know that the representation is one of the big problems. Like there's not enough Black physicians. We don't have the same representation in medicine that we do in the population. We talk so much about DEI, and yet why have we moved backwards?
I know. I mean, it feels so demoralizing, because even you're talking, you mentioned statistics, in terms of students, or, this medical school in the middle of New York City, one of the most diverse cities in the country, and there's one Black medical student. That's just very appalling, I think. And then, I think that's also tied to the fact that, as maternal mortality, we see over the last 20 to 30 years, maternal mortality rates in this country have worsened, right? Despite all the innovations in research, technology, and innovation, right? And so you're why is that happening? And I think part of it is that because when we have a healthcare system that doesn't really holistically care for people, and it's all people, actually, when we look at life expectancy, maternal mortality, right, it's actually for all racial demographic groups, it's lower than other high income countries, because when we don't have the basic policies and programs to keep people healthy. So that's one thing. But I think also these numbers kind of reflect how deeply embedded, racism is in our society. And it's not just interpersonal, but what happens when people, interface with healthcare institutions, when they seek care, sometimes their concerns are often minimized, ignored, or dismissed. And so, you have that. And then you have the whole, becoming a physician. That is a process that requires you to have resources and social capital, exposure. And we still have a very profound racial wealth gap in this country where Black, Latino, Indigenous families, they have a fraction, maybe like 1/7 or 1/6 of the wealth of white families. And we know all of that is incredibly important to someone's success, in a career. So I think there's some really big policy issues that need to be addressed to increase the number of Black physicians, to increase the number of Black medical students, and to make sure our patients and communities are getting the best care possible.
Mm-hmm. I had talked about how you use your personal story to kind of highlight some of these, the racism that exists and the barriers. And I really liked in the beginning of the book, you were talking about your community, first of all, and some of the things you were saying kind of reminded me of pointing out the systemic barriers or social determinants that people face. Yeah. It's interesting that you return to your community like your mom did, and now seeing it as a physician. So what are some of the things that influence how well people do, health-wise and otherwise?
Yeah, I mean, it was when I was in residency, when I went back to the hospital that my mother worked at, the public hospital in Brooklyn called Kings County Hospital, and the University Hospital, SUNY Downstate. It was then that everything I felt like I was supposed to learn in medical school was becoming very obvious. I think, I was seeing a lot of end-stage kidney disease, very poorly controlled high blood pressure, and people coming in with, massive brain bleeds because of that. Uncontrolled diabetes, people coming in with DKA. So it was interesting because I was like, wait a minute, what is going on and why is this happening? And I think, at the time in medical school, there's a lot of emphasis on the pathophysiology, the treatments, but not thinking about, why am I seeing all of these very, very sick patients in the emergency department when we know if they had gotten the preventive care they needed, they wouldn't be ending up here, right? So it's not just about access to medications or quality health care. I think what I recognized was what was happening in people's communities really also impacted their health. Mm-hmm. So this idea of having a more holistic idea of what influences good health. And that's where I was I wish I learned about the social determinants of health in medical school, because this all makes a lot of sense that if you have communities that have been chronically deprived of resources, that impacts how healthy they are.
Right. You talked about even just supermarkets, not without fresh food, or so pollution or environment.
Yeah, exactly. Yes. And I
neighborhoods.
Growing up, I grew up in a neighborhood called Crown Heights in Brooklyn, which is a working middle class, mostly Black American, Afro-Caribbean neighborhood. And we routinely had to drive to another neighborhood to go to a grocery store because we didn't have a grocery store in our neighborhood. Just growing up, I never really understood. I was what? I mean, I kind of thought about it, but I was okay, I guess this is just how it is. And even the schools in my neighborhood, the public schools, my parents didn't really feel comfortable sending us there because they were concerned about us getting a quality education. And it was not until I was an adult that my father was telling me that our neighborhood in Crown Heights was a formerly redlined neighborhood. So that was meaning that was a neighborhood where, the policy in the 1930s was to grade neighborhoods A, B, C, or D, almost primarily based on the racial and ethnic composition of the people who lived there. So if it were mostly neighborhood of color, that means if you live there, banks wouldn't want to invest and give you a federally backed mortgage or mortgage insurance. If you lived in a mostly white neighborhood, you could get a mortgage, qualify. And so what we notice in those neighborhoods, today, even almost 100 years later, is that those neighborhoods that were redlined, those are the neighborhoods with, the most underperforming schools that don't have grocery stores, that don't have even a lot of green space, because there wasn't an investment in making sure that there were trees in these neighborhoods. And those are also the same neighborhoods that have the very worst health outcomes.
Right. It makes sense. Another part of the book, you also talk about when you did get into medical school. Actually, I'm curious before I bring that up, how many Black students were there in your class?
Oh, in our class, we had a good number. I want to say, definitely maybe 15%, maybe.
Mm-hmm.
Yeah.
Do you happen to know what admissions are like now? What percentage of?
No, I
No.
don't know. But it's
Okay.
interesting that you ask because, because of the SCOTUS decision striking down like race conscious
Mm-hmm.
admissions in higher education last year, we do know that there are a number of Ivy League, like undergraduate, colleges that have seen the number of Black students go down.
Okay. Yeah.
Yeah. So, so that is interesting to think about. And like, I
Yes.
don't know what the impact has been on medical education.
Yeah, that's going to be
But
interesting to
yeah,
see and
but I know that
sad.
schools are very scared, like they're worried.
Mhm.
Yeah.
So the thing I wanted to bring up, another experience that you had was in medical school was becoming a patient, and that
I know.
kind of that experience really got you to see the healthcare system in a different light, instead of
Yes.
as a provider of healthcare, but as a patient. So tell us a
Yes.
little bit about that.
That was so life-changing. I mean, like at the time, as a first year medical student, I was in my pharmacology block, and I just remember sitting in class and just feeling really queasy and very ill. And later that day, my sister took me to the emergency department at one of our Harvard teaching hospitals. And, I was examined and told that I had gastroenteritis and sent home, and then went home and just was still not feeling good, and ended up going back a few days later, and was questioned about how much pain was I really in, or a lot about my sexual activity. Which I get. I'm a patient who's a woman, so they're going to ask about that, but it was like very like kind of accusatory. And it wasn't until and I was admitted that time, given IV antibiotics, actually had a CAT scan. My appendix couldn't be visualized. I felt better because of the antibiotics, and I was sent home the next day. And then I came back a few days later with Rigers, just like feeling really cold, shivering. And it turns out that when they scanned me again, I had a ruptured appendicitis. I had to go to the emergency department. To the OR immediately. They did an open appendectomy instead of a laparoscopic because there was so much pus associated with the rupture. And then I developed complications. I had to be out for about a month of school because I developed an intra-abdominal abscess. So, it's like when I look back on it, I'm like, okay, if they had just listened to me. And it was funny because my twin sister, Oni, said during one of the first two visits, she's like, I think you have appendicitis.
Wow. I know. It took repeated visits and ignoring your pain.
Yeah, but as a medical student, I didn't even feel comfortable enough speaking up. So you can imagine what someone who is not in medicine, how they feel.
Right. Or with someone with a language barrier or something like that.
Yes,
even worse.
Oh,
right?
Absolutely.
And this reminds me, your mom also experienced some barriers in her healthcare, correct? Like once she had been diagnosed with, I'm sorry, I forget now what her
acute myelogenous leukemia.
Yes.
Yeah, no, absolutely. I mean, it took a while for them to make the diagnosis of acute myelogenous leukemia, and it's interesting just even reflecting back when I was researching the book and thinking about where my mom grew up. She had been exposed to, not exposed, but she had lived in the areas where there had been Superfund sites. So growing up in areas where there was toxic dumping. And so, when she went for a second opinion for her leukemia, the doctor said it looked like you had been exposed to radiation early in life. And so I'm like, could this have been because of the neighborhoods my mom lived in?
Right. Another example of how your environment can really determine how you do health-wise or success-wise, right?
Yeah, exactly. So I think like that's one of the messages. It's like of people to understand that, I think there's a lot of conversation that like it's like up to the individual, like that's how that influences how successful they are. But really what's even bigger than that is like what the impact of the environment on you.
Right.
and your health.
Right.
Yeah.
Mhm. Continuing, I guess, with your life story after medical school, going
Hmm.
into practice and
Hmm.
also in academia, you experienced some barriers and, obstacles in your
Yeah.
path. So I thought if you could share about that a little bit,
Sure.
maybe
Yeah. And
first
I
as
think,
your experience as an ER physician and then later in academia.
yeah, I mean, I think that, for me, emergency medicine was super exciting as a medical student. Of course, I would have to I wish I had spoken to more mid and late career faculty, especially women faculty or
Mm.
in emergency medicine, just so I could have a better idea of what would life be like, later on in life when I have kids and I'm married and where I'm working nights and weekends. But anyway, all that to say is I think at the time I was very idealistic about the emergency department. And I love this idea of caring for patients that are all comers and that just really need your help and you're there for them in their moment of need. But I think it was like I mentioned before in residency that I recognized that, the emergency department is where kind of all of the social ills of society and social problems of society come to roost. And that's where I really, really saw that in residency. And then when I went to, NYU after for my faculty position, just working both at Bellevue Public Hospital and NYU Private Hospital and seeing such a disparity in the resources that were available to patients because most of the staff and faculty is the same at both places. Like we go back and forth,
Mm.
but to see that the resources or even just the number of nurses, access to follow-up care, it's a huge, huge difference. I mean, we always had more than enough social workers at
Mm.
NYU and had one or two at Bellevue. I thought to myself,
Mm.
the Bellevue patient population is the one that actually they really need the social workers. And so that was very eye-opening for me. And this idea of segregated care or just these two tiers of care that people receive.
Well, first, I want to make a comment about, yeah, I do
Yeah.
feel like that's a really good observation about ERs. I do think they're like the safety net of medicine, right? We have all these gaps in healthcare. Some people are
Yes.
uninsured. And
Yes.
when there's a problem that arises and you don't have primary care or you don't have insurance, people show up in the ER, right? And then that I did think that was interesting. These two hospitals, my impression is they're just short distances away, but completely
Literally
different
2 blocks.
demographic.
Two blocks from each. Actually, one
Wow.
block.
Wow.
Yeah.
Yeah. Completely different demographic. And the other thing I thought was interesting was you talked about some of your patient interactions and the racism you experienced. I'd love for you to
Yeah.
share that. I have a friend who once shared with me some of the microaggressions that she received as a Black physician, not just from patients, but also staff like nurses or other doctors.
I
So
know.
please
I
share
know.
some of that because I don't think
Yeah.
people realize.
No, yeah. I mean, just the idea that often, you know, I think one of the stories I share is that I'd gone to see a patient. I'd been in their room for 20 minutes. I'd been in there a few times, and then I get this call from my chief of service saying the patient in room XYZ is upset they haven't seen a doctor yet. And I realized it's because they didn't even though I introduced myself as Dr. Blackstock, supervising physician, I'm the one supervising the resident. They like something happened in their brain where they just couldn't process that I was actually the physician. That's
Yes.
it's such an erasure. Like you just feel invisible. And then
Mhm.
another case where, the patient was like, I wanted to see that other doctor that saw me first. And I'm like, that was that was either the medical student or the resident. Like they're functioning under my
Mhm.
license,
Yes.
they haven't even finished their training. I've been
Mhm.
practicing for years, but it's interesting. It was a young white man who was my trainee. And so,
Yes.
thinking about who people feel more comfortable with, even if they don't know what their role is or how much they know. So and then
Mhm.
I had another patient say they wanted a second opinion and it's not because it wasn't because I was Black. And I was just like, oh, I was so stunned. So
Yes.
stunned.
It's a
And I don't and honestly I don't have a problem with people asking for a second opinion, but it's just sort of the
Mhm.
way that it's done.
Right. Another reason why we need more representation, it shouldn't be so unbelievable. How wrong is
I
this?
know. Yeah, I know,
Right?
truly. No,
Yes.
truly. Like, I mean, and it's interesting because when I was on air a lot in 2020, 2021, and 2022, I realized for many people watching MSNBC and NBC News, like I literally was probably one of the first Black doctors they'd ever seen because I know I was the first Black medical contributor.
Mhm.
But I mean, people. I mean, the way that people, would reach out to me, it was like I'm like
Yes. I
they've never
know.
had a Black doctor
Crazy.
before. Yeah, yeah,
Yeah. Yeah. And it's so nice for you to be out in the public sharing your thoughts and your knowledge. And I think it's inspiring to other, people of other races and Black young women, especially.
yes.
So we do need that. And yeah, keep doing that, of course.
Thank
Um,
you, thank you.
so now tell us a little bit about your experiences in academia. That was interesting as well.
Yes, I know. I mean, I always thought I would stay in academic medicine for my entire career. My mother was in academics. I love how intellectually stimulating the environment is. Just, not just seeing patients, but doing research and teaching trainees. Like it's just, I love it. I love it. But what I recognized my own experience was that I just, I wasn't getting the mentorship I needed. I was doing a lot on my own. I was trying to figure out my own way of doing things. So, and that's something that is not uncommon. Like when you look in the literature, like Black faculty of color, it's very hard for them to get mentorship because the fact is that people often mentor people who they are similar to. So when you don't have
Mm.
other people there, when there's informal mentoring happening, it just doesn't, you don't get mentored. And we know that mentorship really defines like how successful you are in your
Mm.
career. It's a big part of it. And so that was one piece of it. The other piece was that, I was like in one of the biggest emergency departments in the city, as I mentioned, and as the only Black faculty. And I felt like I was the only one that noticed that or was
Mhm.
concerned about that. Like I would talk to my chair at like every annual one-on-one I had with him. And he's like, well, what should we do? And I'm like, well, why do I have to be the one to solve all the problems?
Mm.
Like,
Right,
figure it
right,
out.
right.
But, you know, I got to this point 7 years in where I had been doing a lot of medical education work. I had started our department's first ultrasound fellowship. I had developed the 4-year curriculum for the medical school, just using bedside ultrasound to complement teaching anatomy and physiology. I thought I was doing everything I was supposed to do. And then I got handpicked for this DEI role in our Office of Diversity Affairs. And it was really demoralizing when I found out that really it was just a figurehead role. They didn't was performative. They didn't really want me to do anything. And, I think from the outside, people probably looked at me and said, oh my God, she's so successful. She's, doing so much. And I really felt very empty and even scared because I was very much under a microscope. I had to, like, they were looking at my social media. Like, it's just I
Mm.
think academic medicine, like, it's super just conservative. And then I'm talking about politically conservative, just conservative
Yes, yes.
overall. And, I was involved with Time's Up Healthcare, which is, what was the healthcare arm of Time's Up, addressing gender equity and, sexual harassment. And that was considered too political. Like that's too, I'm
Mm.
like, wait a minute, what? Gender equity in medicine and healthcare?
Mhm.
That's too
Right,
political. Being
right.
like speaking up about sexual harassment. And then that was around the time when there was a National Academy of Science and Engineering and Medicine report that came out showing that medical students, trainees, faculty were experiencing a lot of sexual harassment. It was something that wasn't talked about.
Mhm. Mhm. I love how outspoken you are, and that you have opinions. I personally think that medicine is political. I'm sorry. These
Yeah,
policies we make in this
yeah,
country definitely affect
yeah,
people's health.
yes.
And so I think it's kind of strange for people to expect doctors to be bland and unopinionated, you
I
know?
know, I know, I know. But there's like a movement saying that doctors should just take care of patients and shouldn't be
Right.
involved in, any sort of thing that seems remotely political. But in
I
this
love
country,
that.
health is political. Yeah.
So I love that story you told about, okay, because I'm opinionated and I've gotten in trouble on Twitter, but that story about you sharing your thoughts on Twitter and that causing a lot of backlash. Do you want to share that?
Yeah. So this was a few years ago when there was a lot happening around, or actually probably after 2020, after, George Floyd's murder, Breonna Taylor, BLM, and, a lot of hospitals were thinking about like, how can we do better? And so one hospital, the Harvard Teaching Hospitals, they took down some of the portraits that were in their main auditorium. This is the auditorium that people go to for lectures, right? Guest visitors and all that. And so it was interesting because someone wrote it. There's a piece, an op-ed in the Boston Globe about it, and how I think most people they agreed because literally this wall. I remember sitting in that room as a medical student. That wall was all a wall of like old white men, right? No diversity at all, not even gender diversity. And the former dean of my med school wrote, "Oh, I'm like basically he's so upset about this decision. These were luminaries in medicine and surgery, like kind of like how disrespectful, right?" And I was sort of like, I was so taken aback. I said, "Oh my goodness, like, do you recognize that wall represents a history of exclusion? Like, there's so many other people that should have also been on that wall that couldn't because of policies that didn't even allow them into medical school. Like, that's a wall of privilege, And I guess other folks at my medical school saw it, and instead of I think I mentioned actually the Flexner report, the report that closed, a lot of medical schools, including some of the historically Black medical schools, but there are only 7 of those schools and 5 of them closed. But it's kind of giving like a history lesson, and instead of my school being like proud, I was like slapped on the wrist about that.
Yes, it's so crazy. It reflects the racism in our country, keeping people out. Not only that, I think when this actually just reminds me that we need to teach about the history of medicine much more because it also reflects the idolization of people who frankly took advantage of others. Black women is what I think of when I think of, for example, Marion Sims, but so abuses of the past, abuse of slaves, for example. So I loved how you weaved all of that through your journey.
Yeah, thank you. I actually wanted to make sure that it's a memoir, but it's not like a typical memoir because like there definitely are those personal stories, but I wanted to make sure I included the history and like the social commentary, just so that people we're able to connect with these really lofty ideas that sometimes we talk about, but hopefully it'll help bring it home for them.
Yes, I think it's so important. I mean, to put it in context, I don't know, I think it made it more powerful. These are your personal stories, but everyone has their own stories, so it's relatable.
Yes.
That was illuminating. I see superficially how there are more of these positions now, like positions like in charge of diversity affairs, in institutions. And now I'm looking at them more critically, like, are they muzzling? Are they muzzling these faculty members?
I know. Yes.
I got the impression, the other thing I admire is is it's very hard to leave academic medicine. That is what everyone works for. Often these positions are what doctors work so many years to attain. And you left because they were holding you back and you couldn't be your authentic self, which is so important.
Yeah. Exactly. And it's like, I sometimes, I'm very honest about this. Like, I sometimes grieve about what, like, the career that I could have had in academic medicine if it wasn't a more, hospitable, inviting environment. Like, if I could have shown up more as authentic self. But at the same time, I have to say, like, once I left, the opportunities and abundance that, became available to me was just, and still is, so amazing and overwhelming. I would never have been able to imagine it. Almost like felt like being in that environment restricted my imagination, my creativity of even thinking about what is possible. Like literally once I left, doors open that I never even thought would open.
That's amazing. I think the message from that is to have the courage to leave bad situations, and I'm a believer in that. I'm also, I would love to have a career in one place, right? But if a situation is toxic or doesn't support me, I'm a leaver. Yes.
Yeah.
So,
yeah.
I got the impression that you were still working clinically
No, yeah.
in that urgent care, but so you did that for a short time.
Yes, I probably, it's now been like 3.5 years because I left in, I think it was maybe, I think 2021 because, end of 2021, because I just could not manage being on air, running and growing my company, really growing my advancing health equity. When you get down to working maybe 1 or 2 shifts a week, for me, that's not enough to feel comfortable with seeing patients. I just needed to do the right thing. And also I just realized I just didn't have the bandwidth. Interestingly, someone asked me yesterday at one of my talks, they said, "Oh, do you miss seeing patients?" I said, of course I miss seeing patients. I love that one-on-one interaction, but also at the same time, I feel like the work that I'm doing now is impactful in a very different way and at a different level. So I'm grateful for that.
Can you tell us about that a little bit? About your work now?
Yeah. Even my company Advancing Health Equity, when we started out, it was just me. Now we have over 13 team members, but really I founded the organization with the goal of doing both internal and external equity work with health and health adjacent organizations. So we work with departments of health, we work with other nonprofits, hospital systems, academic departments. Some of our departments are within academic medicine, pharma companies. So companies that really need support as they go along their health equity journey. And so we offer anywhere from trainings to assessments and audits to strategic planning, capacity building, technical assistance. What I really love the most is doing the strategic planning with them and implementing what their health equity journey is going to look like over the next 5 to 10 years, because a lot of times it's selection bias, but these companies and organizations that come to us, they are the ones that kind of want to do the work, or they actually have key stakeholders in the organizations that want to do the work. So I get to do this really amazing work that I wasn't able to do when I was in academic medicine. And we're actually by the time this airs, this will be revealed, but we're actually trying to scale and grow the company more. And so I'm going to be transitioning from being CEO to chief advisor, and I'm bringing in a CEO. And we're just trying to just get bigger and better. I want to be known as, this is just, if you are interested in improving your health equity capacity, this is the firm that you want to work with.
Amazing. So what is your new role? What are you going to be? How is your role changing?
Yeah, great question. So part of it is that I feel like as CEO, I deal a lot with the day-to-day of the company. And I really feel like at this point, it's almost 6 years old as the founder, I really want to see it grow even more. And I honestly I recognize that I'm the limiting factor because I'm so busy and I have so much to do that I really need someone who can really commit to building the company. And what I will be doing is working closely with our new CEO to ensure that all the work is in alignment with our mission and our vision, and obviously ensure that everything in the company continues to go well and that we grow and scale as we would like to. So I'll just be more in an advisory role to our CEO.
I see. So you're not going to, so I thought that story about the training you did, so I get the impression that you're working with organizations. Do you still go out and do those trainings? I like that story.
So I don't do them myself anymore because we have a team of really wonderful facilitators that can do that. So I had to step away from all that. I just didn't have the bandwidth.
Yes.
I have amazing facilitators that do that. So who have even more training than I do. So I'm yes, you would actually take this really wonderful facilitator who's been facilitating for 20 years, Yeah.
Great. Thank you. I wish you good luck with that.
Thank you.
another aspect of your book was just talking about your personal life and becoming a mom and how you balance that. And I, of course, as an OBGYN, I was very interested in you talking about your experience as a patient, as a physician and a patient, being cared for like during your pregnancy and childbirth. So.
Yeah, I mean, I feel like my first pregnancy, first of all, I mean, I think no one really talks about the experiences of like being pregnant and having children. And I feel like it's a lot. Like, I feel like when you're thinking about like all your different roles, I know for me, being a mom is like my most significant one. I think people would be surprised given everything I do, but I'm like, no, this is the hardest job ever.
I agree. I agree.
I'm
and
like,
my
I am
number one
so
priority.
Yes, absolutely. And so it's really humbling. But yeah, I think for me, it was also a learning lesson. Like, I had chosen an OBGYN who her practice had a very low C-section rate. And I just kind of was like, I just want to like have a positive experience. And I ended up having kind of, traumatic delivery. I had to have like an episiotomy. They were using forceps. It was just like, oh my God. And my now ex-husband at the time, he obviously was trying to do his best to support me. It was just super scary. And so I kind of like, after that, I was like, okay, what do I need to do the next time so that I'm like more prepared? And that's when I went down this journey of like finding out about doulas. I had never even heard of a doula, just thinking about like, what do I need to do to make sure that I have like all hands on deck next time so that I don't feel like, that's so scary. Yeah.
Yes. I thought your book was, I know it was a personal story, but it was also very educational. And I do have an upcoming episode with a doula actually. And I think
awesome.
I do like that message, for women to find ways to advocate for themselves, because it is a risk as a Black woman in this country, right? The morbidity and mortality rates are higher, and you're absolutely right. We have inappropriately high C-section rates, and so yes, we do need to often take our health, journey into our own hands, right? So I did have a question from the audience, an anonymous question. What advice would you give to young Black women aspiring to enter medicine or other healthcare professions, especially those concerned about potential barriers?
Yeah, it's interesting because I feel like I wrote legacy for my younger self, just kind of like wish I could have been aware of a lot of these issues before I went. Just kind of, I would make sure I had eyes more wide open. But I think what I would say to them is that it's really important that when we go through these like difficult experiences, like, professionally and even personally, but professionally, that, we make sure we have like a village around us, that we don't just keep it inside. I think for me, there was a lot of shame when things were happening to me in academic medicine that I didn't talk to people about it. I was so embarrassed, and come to find out, like when I've written about it and now this book, people are like, oh my goodness, like I went through the same thing. So I think it's really important to share our stories, like find other people that you feel safe with to really share your story, and you recognize that you're not the only one. I think there's also a lot of strength in numbers as well. And just community building is important. But the other thing is I want to tell our younger generation is that, so often when we go into organizations and institutions, we kind of feel like, oh my goodness, I'm so lucky to be here. And really we should have like also the opposite perspective, like they're so lucky to have us. I think we come in with very unique perspectives that, may not seem so valued by these institutions, but really they're gifts. Like we're bringing in gifts, that fact that we have had these really sometimes challenging lived experiences, but it lets us like view things through a different lens. And I want us to remember that, like when we're interviewing places and we're trying to figure out if the place is a good match for us, that we need to really also be interviewing them, right? Like what is their commitment to, to some of these efforts? Like how do they support their Black faculty or Black, physicians? So so just always remember that you're the gifts coming into these institutions. It's not the reverse.
I love that message, and I feel like that is that reminds me of what you said earlier. They really leaned on you as one of the few Black physicians in their organization.
You're so right.
They leaned excessively on you because you were the only one of few.
Yes.
So that is good to remember that you should be interviewing them because they need you badly. They don't have enough diversity.
Exactly.
And then also that reminded me, I think that, challenges like this, we don't want to have challenges like this in life, but challenges like this do make you a better doctor. You're just more compassionate.
Yes. And
absolutely. You can understand what the patient is going through a little more, maybe because you've lived it. So, and we didn't even get to touch upon your mentorship, but I like those stories too. So I just wanted to mention that. I think it is really important to look for mentors, So
absolutely. Yeah. And then recognizing that sometimes mentors may not always be in your department. They may be in other specialties, other institutions, but you have to seek them out.
Great. So do you have any closing thoughts? And also, tell us what else you're going to be doing, what you're working on now, and if you have any closing thoughts.
Well, I'm still, actually, this year has been a whirlwind since the book came out in January. I've been on so many book talks and visits and had a lot of speaking opportunities, and it's continuing into the new year. I mean, to be honest with you, I'm worried about the transition to the new, administration and what that means for a lot of the work that I do, but it just makes me even more committed. It makes this work even more urgent. So I know that my company, Advancing Health Equity, we're going to have a lot of very important work to do. And I just hope to really continue networking and connecting with other people who really feel deeply about these issues, same ones I do.
We didn't even talk about that, but this episode was originally going to air the day after the election. And I was very optimistic that, you as the Black physician, me as the Indian physician, we were going to be celebrating Kamala, Black Indian president. But
right.
So we need you more. We need you more than ever. Of course, that's how I feel. I feel like this is needed more than ever.
Yes, I agree.
Tell my audience where they can find you to keep up with what your comings and goings.
I think I'm on almost all social media platforms, and just put my name in and you'll find it. Just put in Uché Blackstock, but I am on Twitter. I'm on LinkedIn, Instagram, Blue Sky, Facebook. So I'm often updating what I'm up to. So feel free to follow me in there.
Okay, I will be tagging you in my show notes, so visit there to follow her. Yes. And I always leave with a closing thought. So I'm gonna do that. The patriarchy would like us to forget the horrors of the past and the incredible debt we owe to Black Americans, especially Black women who bear the greatest burden and abuse in our country. In the Gynarchy, we seek to remember the mistakes of the past, acknowledge the inequities we see that are a reflection of the continued abuse of Black people, and we seek to make reparations until people of all color can thrive. So down with the patriarchy and up with the Gynarchy.
Yes, love that.
Thank you so much.
Thanks so much for having me.
Thank you, Uché. Did you enjoy this episode of the Gynarchy Podcast? Know someone else who might enjoy this conversation? Make sure to subscribe and share the show with your friends and family. Find us on Apple, Spotify, YouTube, and just about anywhere you find podcasts. On social media, we can be found on Blue Sky, Instagram, and TikTok at The Gynarchy. Thank you so much for listening.